for research, teaching, and also clinics. The main entrance, the reception room. We have today some differences right now because of the pandemic, but all things concerning and all the things concerning COVID. But this is the reception room, our library, and our board of publications. We used to say that this board represents a little bit of competitiveness between our students. Everybody wants to have their paper in this board, but it's a good thing. Everyone would like to have this paper hanging there. We have the 4 dental office for in vivo and in vitro research for patients, our classroom where we have the workshop, and we have some international programs. We used to receive students and dentists from all over the world to train about lasers in dentistry. Our biosafety procedures concerning the use of lasers. And we have more than 50 low power lasers. We used to do photobiomodulation, and I saw that in 3 weeks we will have another seminar that will be very interesting with Dr. Lan Tran, and she's going to talk a little bit more about low power lasers and photobiomodulation. We have also the high power lasers, and we have more than 15 equipments with all the wavelengths. But I used to say that one important thing is our philosophy, because we have to know all the areas of dentistry, all the areas, and laser is going to be like something extra, something that is being together with dentistry. We have to know the research protocol. We have to analyze the correct irradiation parameters, and we have to have scientific basis in all the clinical actions we are doing. And one word that I like most is commitment. So we used to ask for our volunteers, dentists, students, that we have to be very committed to what we are doing right now. So I used to say that Lelo is a combination of teaching, research, and clinics. But I should tell you that since September last year, 2020, I asked to be a part-time professor, and I opened a clinic in São Paulo. The name is São Paulo Dental Studio, and this clinic comprehends the dental clinics, space for co-working. So dentists from all over Brazil used to come and have their patients with us. And we also have a school, a training center. This was part of a significant change in my career, in my daily routine, but I'm very happy to be in the clinics. So today I will talk about prevention. And as I told you, this topic is one of my favorite. In the last year, I have been talking about this, but as a professor from the restorative dentistry department, people used to ask me to talk about laminates, to talk about porcelain, composites, and of course I like them. But we are living in an area where dentistry has gained more power, visibility, and we should talk more about prevention with our colleagues, our patients, and our family too. Talking about prevention for me is to talk about health and also the promotion of oral health. The moment right now is of transformation. We know that we are right now in a moment that all the world changed a lot. This, in fact, has been happening even before the pandemic. We are rethinking a lot of things, including less is more. This is a famous phrase by a famous German architect, Ludwig van der Hu, and that means by doing less, we can achieve results as good as we are doing a lot. And from this architectural point of view in life, also, we can extrapolate to dentistry and even more to prevention performed in dentistry. Perhaps some time ago, preventive procedures were not a concern. But right now, and we were thinking and we were doing a lot of science and research to combat a virus that was threatening the world. So Today, with the increase also in the longevity and life expectancy of patients, advances in oral disease not related to microorganisms, such as wear, premature oral aging, lifestyle changes, advances in restorative dentistry, in all materials, everything changed. So this makes us think about how we will keep or preserve this, our teeth and the teeth of our patients longer in the oral cavity. The question is, how will we raise the banner of prevention, showing the benefits in tissue preservation, in early detection of carious and non-carious lesions, the preventive maintenance of restorations, direct or indirect restorations, and the control of caries and non-carious diseases. We are currently observing an inversion of values and importance in procedures, maybe. We are talking more about procedures, restorative procedures, than prevention. And sometimes we have to talk and to stop and talk more about prevention. People used to say, doing preventive measures in my dental office is not a cost effective. I don't earn money doing prevention. But I should tell you that is the opposite. Prevention is the basis of everything. So prevention is more, in addition, also to identify the risks of your patient, making room for listening to the patient, understanding their routine, expectations, anxieties, desires. We should individualize. We should communicate patient, explain, prescribe oral hygiene products, motivate our patient to have oral health that will affect their overall health. Are we going to review these concepts? Are we going to think in an inter and multi-professional way? It's past time. I'm a professor and a researcher, and I really want, together with all professors, to show that prevention is worthwhile. That prevention, as I said, is the basic thing. I used to say that lasers are a big concept in dentistry, but I have to say to you that prevention is also a big concept, because if we're doing prevention in our dental offices, probably we will decrease the number of restorations we are doing, but we have more health, we have more patients that will be happier with us. So concerning carious lesions, I will talk about carious lesions and also the prevention of non-carious lesions. But concerning carious lesions, we should know how to detect, how to diagnose, how to arrest some lesions. So we are going to observe the process of the carious lesions, but we have to arrest. And also we have to know the risk assessment, the risk for carious lesions for each patient. This approach requires the practitioner to start by differentiation between the carious disease process and the carious lesion, and shift their focus from a primary surgical intervention model direct at the cavity to a prevention and preservation of tissue. So if we read something about modern caries management, they stresses the philosophy with individualized risk assessment and disease management. If we are talking with the patient, we can observe the patient, it will be easy to know and to make the risk assessment. And as I told you, we will decrease the number of restorative procedures, but if we have to make any intervention, it's going to be less invasive. So that's what we call right now the minimally invasive dentistry. This is a very this paper I'm showing you. It's a very nice paper. It's a systematic review. It's going to have a lot of papers from concerning the subject, and they are talking about non-restorative treatments for caries right now. So we are doing a lot of non-restorative things. So prevention in caries lesions, it's more than, we know that we have to brush the teeth twice a day with a fluoride toothpaste, and that fluoride is a very important issue that we should talk. Fluoride has the main advantage of uh, 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 it has an impact in caries lesions, that we should clean our teeth daily with. We have to floss, we have to have this nutritious and balanced meals and limit snacking, to visit your dentist regularly for cleanings and oral examinations. We are doing that, we should do that with all the patients. But I would like to call your attention about, not even with carious lesions, but also with the non-carious cervical lesions. And here I'll show you a professor, a friend of mine. His name is Paulo Vinicius, and he has a book, a very nice book. And he's calling attention about tooth wear, about erosive tooth wear. But the non-carious cervical lesions is a topic, it's a hot topic right now for us to talk a little bit. His book is very interesting and I recommend. But what are the non-carious cervical lesions? Academically, we can divide the non-carious cervical lesions into erosion, abrasion, abfraction lesions. However, this division makes dental surgeons confused with different characteristics and similarities of the lesions. So today we are talking more about the mechanism, regardless of the terminology that we learn. But we are going to talk about mechanism of tension, friction, and erosion. In general, non-carious cervical lesions are aware. Uh, it's a tooth wear not related to tooth decay. We do not have any microorganisms related to non-carious cervical lesions. We have a multifactorial origin, and we need to know this, to know not only this definition but the etiological factors involved. And I'll talk a little bit about this, so we can determine an effective treatment protocol. And the results are a result of the process. But I will begin with this example. What do these people have in common? I'll show you Eduardo. Eduardo is 70 years old. He's a businessman. He told me he has a high consumption of acidic foods and little sports practice. And then Barbara, she's my undergrad student, 24 years old, undergraduate, semi-professional athlete. I know, Barbara, that when we were in the university with classes in the university, I used to see her every day during lunchtime playing some sport, doing basketball or volleyball. She was doing, because she's in the team of the school, and with all the competitions, the sport competitions. She's a former user of orthodontic appliance, but now she's going to do a new orthodontic treatment. But let's see their mouth. So let's open their mouth. So Eduardo is like this, with 70 years old, and Barbara is like that. But Barbara, she looked for me because she has pain. She has dentin hypersensitivity. We can see that. We can see the non-carious cervical lesions and a little bit about gingival recession together. But she was telling me that she cannot drink anything cold. She cannot eat sometimes a chocolate or even the air conditioner. She's very worried, and she's very young, and she's very worried about this. And her quality of life decreased. But Eduardo, he's fine. He was with his wife in a dental treatment, and I told him, "Are you with pain? Do you have any dentin hypersensitivity?" "No, I don't." But what we are doing, what we are seeing now, is that Barbara, with 24 years old, she can be like Eduardo in a few moments, in a few years, not when she's going to be 70 years old. And that's the reason why we are calling attention. That's why Professor Paulo Vinicius, the author of that important book, is telling you that we have so many people right now. There are suffering with dentin hypersensitivity. And after the pandemic, we have been seeing a lot of patients suffering with dentin hypersensitivity and also with the non-carrier cervical lesions. So our main objective right now is not to also to look for the non-carriers, the carriers lesions, and to advise the patient about all the things we have learned in the school, but also with tooth wear. We have to make this awareness with younger patients because we can see that this month, for example, the age of this patient, I would suggest that this patient is like more than 70 years old, but not. He was 40 years old, 40. So, would you care about this patient? Of course, I will be very uh, uh, worried about this patient. So, something we have to do. Right now, we are in a time that we have been doing a reflection. It's new times. We changed a lot of things. We are living in uncertainties. So, imagine your patient at home right now. Is he suffering some anxiety because he doesn't know if he's going back to work or not, if we are going to have another lockdown or not? This patient had gastric reflux, esophageal reflux. So before pandemic and right now after pandemia, it's not after, but during, all the problems uh, uh, are bigger. So we have to know that we have to think positively. We have to communicate with the patient. We have to make all the advices to the patient. We have to change something. We have to make our attitudes. We have to make a balance. So balance right now is a very nice word. So I'll show you this article that a Brazilian journalist wrote. It's in Portuguese, sorry for that. But the title is A Generation with Dentin Hypersensitivity. And it was written by me, Professor Paulo, and also Professor Renato Mioto Paulo, who is in Salt Lake City right now. So it's a new perspective of treatment that catch the eyes of the new lifestyle of the modern people. And the journalist was very happy because he made this awareness to the patient. And it was a magazine for patients in an office, in a great dental office. And he said, something is occurring right now, something we should do right now, because we know that we have to make another eye for this patient. Okay, we know that dentistry, as a constantly evolving science, has been seeing great changes in recent years, not only in the development of restorative techniques, procedures, but also in the prevention and progression of diseases that will affect the oral cavity. So today we can already see advances, but I'll show you some topics and some facts that we should have a new look for our patient. And this look for our patient and these 5 topics I'll show you that change the profile of our population. Caring for these changes will provide more knowledge, better diagnosis, and more effective treatments. And the first one is the minimum invasive dentistry. So I told you about carious lesions, but we know that we are decreasing the number of caries. The contemporary concepts of minimally invasive dentistry made the procedures more conservative. Preventive measures for caries disease were successfully put into practice. This is a graphic that shows a program in Brazil, that even in Brazil, that we have so many oral problems with our population, but we have seen in the last years a decrease, a substantial decrease in caries. This is a worldwide decrease also. The prevalence of dental caries right now it's lower. In addition to the decrease in the incidence of carious lesions and the evolution of preventive dentistry, we observe here is also the graphic in the Brazilian population, but it's getting older. It's aging. This is a chart that clearly shows the process and here we can see that this pyramid in 1980, but right now we are doing a projection for in more than 30 years. So this is an inversion of the age pyramid. We are going to have more people older than younger people right now in some years. In addition, the population ages and still lives longer. The increasing longevity and life expectancy of Brazilians is remarkable, varying from state to state, but average 75 years old. This is what we are facing the world right now. Okay, but also the change in the lifestyle of population, changes in diet, medication, habits. So we are facing these changes, and we should talk to the patient. One thing that is very, very important is talk to the patient, talk about expectations, talk about everything that he's doing in his daily routine. We have seen so far that population lives longer, has greater access to caries prevention strategies, keep their teeth in the oral cavity for longer. But this population has changed a lot in terms of profile and habits. In addition to adopting a more acidic and industrialized diet, the daily use of medications that can directly interfere with salivary flow, the adoption of health habits, the constant concern with physical well-being, and finally the anxiety. So we should be what all these facts wants to tell you, that we have seen a decrease of carious lesions and a high prevalence of non-carious cervical lesions and dentin hypersensitivity. As I told you, the non-carious cervical lesions is going to comprehend the three mechanisms of tension, friction, and erosion. And this diagram represents the risk factors. It is in the book of Professor Paulo that we're going to talk about tension, friction, and corrosion or dental erosion. The prevalence and distribution is 1 in 7 people of the adult population, but we have some papers here. This was developed in the University of São Paulo with Professor Thais Scaramucci, and we showed a prevalence of 46% of people with dentin hypersensitivity. Also, we developed another and more complex study with the prevalence of non-carious cervical lesions in 67.8%. And dentin hypersensitivity is very, very, very high also. But I should tell you that the worldwide prevalence is 33.5%. High degree heterogeneity between studies, but this is very high. I should consider that is very high. This is a paper from Professor Paulo team that show also all data about the high prevalence of dentin hypersensitivity. But one thing I like most of this paper is the clinical significance that increasing distribution of non-carious cervical lesions, dentin hypersensitivity, and gingival recession is closely associated with people's lifestyle. Thus, it is important that clinicians recognize the etiological factors and their most relevant associations to prevent and control such changes in order to improve the quality of life in the population. This is very nice phrase. This is very nice to talk about right now. This a very important paper. And this last one shows that the prevalence of dentin hypersensitivity in a sample that he was talking about children. Almost 1 in 5 adolescents had dentin hypersensitivity. So it's going to be very important for us to talk with children and adolescents also. So it's very important issue. From all this data, we can see the number of cases of non-carious cervical lesions and dentin hypersensitivity is increasing a lot every year. And much needs to be done. A lot of things can be done to control this condition. A first conclusion that the most pronounced dental wear observed today and increasingly early tends to have pathological issues, and the dental so the clinicians must know all the characteristics of the etiological process, why this lesion is right now. We have to make the diagnosis, which will enable us to implement preventive measures, prevent the progression, and also to establish a treatment when necessary. But talking very shortly about dental erosion, we know that dental erosion is the main process because it's the softening of the enamel surface and loss of glow. So we have a continuous dissolution and exposure of dental tubules that will give us the dentin hypersensitivity. We have the dental abrasion and the mechanism of friction. We know that inadequate brushing, this mechanical wear is very important, but our studies show that brushing factor alone does not promote wear on enamel and also does not have an impact in the loss of dentin structure, and it goes together with the literature. So dental brushing is not the main problem, but it's also together with an acidic diet, a very aggressive things to do in your in the teeth. Okay, so we have a lot of papers concerning the whole of desensitizing dental creams and toothpastes. We have so many papers showing the performance of these toothpastes. And we have here also the abfraction and the mechanism of tension. There is very related to occlusal instability with parafunctional things. The literature is a little bit polemic, but we do not have anything close together that said no, abfraction is the geological factor is the paranormal function we have. But in the clinics, we can see that if we have right now more stressed people, we will have a lot of non-carious cervical lesions. And then we have this direct correlation between non-carious cervical lesions and dentin hypersensitivity. As I told you, dentin hypersensitivity, as I told you, like Barbara, my student, she has dentin hypersensitivity, and this was her big problem. She didn't came to me and said, oh, I have a non-carious cervical lesion right now. She was complaining about pain. And we have a close definition, a very nice definition about dentin hypersensitivity. That is the characterization of a brief and acute pain arise from exposed dentin. And also, I would make correction here that also the thin enamel will also be responsible to the typical thermal, tactile, osmotic, chemical stimuli that which cannot be attributed to any other form of dental defect or disease. And surely it will decrease the quality of life of your patient. And these are two studies from Brazilian groups that show that Brazilians suffer a lot and the quality of life is decreased with dentin hypersensitivity. Okay, but how to know the etiological factors? We have to know this condition. We have to diagnose. We have to draw a treatment plan. We have to make all the photographs, maybe the study models to know the progression of the disease. Yes, it is a disease right now. So we have to know that it's a disease because a lot of people is suffering from dentin hypersensitivity right now. We have to identify risk factors. And how can we do this diagnosis? We have to talk with the patient. We have to talk with them. We have to waste, I don't like this word, but we have to waste a little bit of time before doing a treatment if it's necessary. But we should talk to the patient. We should make these diagnostic steps. We are going to talk with the patient and know about his lifestyle. We will make this differential diagnosis to see if it's really dentin hypersensitivity, or it's not a carious lesion or anything else. We have to make extra oral examination and then intraoral examination. We have to observe the occlusal aspects of the patient to know the profile analysis and salivary parameters. Maybe he's doing oncologic treatment and doing radiotherapy. We know that the salivary gland will suffer. So we should know that. We should know all the medicaments he's taking every day. Maybe the salivary flow will also be interfered. We should know the profile of his diet. Oh, I should know what my patient is eating? Yes, I should know. Can we change something? No, it's not our duty to make any changes in his diet. But if he's eating a lot of acidic things, we can do something to prevent the disease. We should tell him to do something that I'll show you to prevent the non-carious cervical lesions, for example. We can analyze the process of the hygiene. We should ask him to bring his toothpaste and his brush to the office and know how he's doing this. As I told you, the hygiene process is not such a big problem, but we can advise him to make something less dangerous for his teeth. And we should also do the hypersensitivity test, okay? And then we can make the risk of our patient. Is your patient included in a risk group for dentin hypersensitivity and non-carious cervical lesions? What are the risk groups? The orthodontic patients, the patients with parafunctional habits, athletes, patients with gastric diseases and also eating disorders, patients that abuse of drugs or illegal substances, and even the ones that take medicine every day. So after knowing your patient, after screening your patient, and I should consider that the first visit of the patient in my clinics, I will waste more than an hour sometimes talking to him. It's a 1 hour talking, and sometimes we have an easy conversation with the patient, and sometimes we have to have more time to screen the patient. And after that, I'm ready to talk about prevention with him. And the prevention strategies and a guideline is like this. So we are talking about toothpastes with fluoride, with sometimes with modified fluoride as the amine fluoride, the Olafluor. It's a very nice one. We're studying a lot of this toothpaste with fluoride to prevent dental erosion, avoid brushing the teeth after acid consumption, to protect the tooth with protective something to prevent tension in controlling the occlusal balance. We have so many things that we have to do with our patient. And sometimes we're not going to change a lot of things for him because changing is difficult for most of us. So we are going to advise him how to make this preventive strategies. And sometimes we need to treat the patient because he's with pain. Sometimes he will need desensitization, sometimes he will need restoration, and sometimes he will need periodontal surgery because he has a gingival recession. But how can I know if I'm going to desensitize, restore, or make any surgery with the patient? It depends on how they lost the tissue. So if we have more than 1 millimeter or more than 2 millimeters without gingival recession, for example, we are doing the restoration of the tooth. If we need to cover something, we are going to make a surgery because if we have gingival recession. But if we do not have any gingival recession and we do not have a cavity, if we have a cavity, we have to restore the teeth. But if not, we don't have, we are going just to make a desensitizing. We have to observe the gingival phenotype classification. We have to know the severity of this dentin hypersensitivity. Sometimes it's something that does not make any problem for our patient, but we have to desensitize. We have to know the depth of the non-carrier cervical lesions. But I will talk a little bit about the strategies for dentin desensitizing, for dentin hypersensitivity. And for more than 5 years, I used to work just with neural desensitizing agents, with oxalates, with nitrate, potassium nitrate, and also the low power laser. But after I studied, we made more than 10 years ago at the Special Laboratory of Lasers, we started to do a combination between neural and obliteration strategies. So we had better results. From them, I should show you some papers from my team that studies the dentin desensitizing agents on tubule, occlusion, erosive wear. But we have been talking a lot about lasers, which are innovative, conservative, reproducible, and effective alternative to the treatment. And in 3 weeks, you will have Dr. Lantran talking about photobiomodulation, and I think it's going to be very, very nice. But talking about lasers, we are talking about low power lasers and high power lasers. It's not the topic for today, but just to let you know, when we are going to talk about dentin desensitizing strategies, the low power lasers, the photobiomodulation, we do not have any thermal effects. We are going to have analgesia, tissue biomodulation, and it will support all the conventional procedures we have in dentistry. On the other hand, high power lasers has a photothermal effect with temperature rise. Oh, it's going too fast. Cutting soft tissue, remove bone tissue, hard and decayed dental tissue. So it's going to use the heat. We have so many wavelengths. This is our clinical protocol that we made in 2010 at LELO, at the Special Laboratory of Lasers. And from now we have more than 5 papers published about this topic. And what we did at that time, we combined the neural strategies with the obliteration strategies. So right now, the strategy of treatment is to combine these two. The name of this protocol is the associative protocol for dentin hypersensitivity, to control the pain. And why do I used to say it's the control of the management of the pain? Because the treatment is to change a little bit of the habits of your patient and also treat the pain and control the pain. So we're going to treat all the patient with this protocol. And how is this protocol that we have been doing for years, and we have so many good results? The first 3 visits, we're going to do the potassium nitrate. I'll show you how to do that, and the low power laser. And we have the 3 sessions for low power lasers. After that, after finishing the neuro sessions with the intervals of 2 or 3 days maximum, of course, we can have this sequentially also, but we have the obliterative procedures. So we have the high power lasers because it's heat, and we can also use another sealant, for example. So this neurotherapy is the low power lasers. Professor Lantran, Dr. Lantran is going to show you about dentin hypersensitivity and all the treatments. And after that, after finishing the photobiomodulation procedure, we are going to use the potassium nitrate, 3%, as the ultra easy from Ultradent. I think is the best because his has a concentration, a very nice concentration, and it's a very nice product for you to apply for 5 minutes. And after that, we can make this obliterating therapy with, for example, we can do this with the enamelast, and also using the UltraPack. But also the high power lasers can be a very useful treatment for us. The diode laser, as the Gemini, like this. I'll show you a video.
Please
because the laser can talk with us.
810.
So we
Stand
can
by.
change. We can choose the wavelength.
980. Stand by. Dual wavelength. Stand by. General dentistry.
And look for the procedure we would like to do.
Orthodontics. Hygiene. Aiming light.
The patients used to like
Orthodontics.
a lot.
General dentistry. Gingivectomy. Active.
Yes, we have this aiming light also there. It's very nice. This is a very nice diode laser, a high power laser that also I have some news for you here. The wavelength is a diode. The absorption with the tissue is water, melanin, hemoglobin. And this laser cut, coagulate, cauterize, biostimulate, and reduce microorganisms because of the heat. And also for dentin hypersensitivity, we can do the melting process of the dentin. And we know that it's for a longer period, we will have this result, decreasing the pain. For soft tissue, it's a very nice one. This is a case from a 6-year-old girl, and we did the frenectomy with the Gemini. This is immediately after the surgery, and she has already her orthodontic appliance. And this is 5 days after the surgery. And the post-operatory is very, very nice. Also, another case of this patient that we were doing the frenectomy and also the depigmentation of the melanin tissue. So we did the procedure, and it's very, very soft, and we can cut the tissue very easy, very fast. So this another one, we made a gingivoplasty with the Gemini. Also, we can decrease the quantity of anesthesia also, and the post-operatory procedure is very, very comfortable. It's 7 days after that. So the impact of lasers in our daily clinic, I would say that with Gemini, we don't have any bleeding during soft tissue removal, as you saw in the pictures, less anesthesia, the procedure is very fast, and the most important thing is the less post-operative pain we have and a faster healing. So we have these high power lasers. Also, for the prevention of non-carrier cervical lesions, we are studying the diodes for the prevention of the non-carrier cervical lesions. We can have this high power lasers for that to stop the progression of tissue loss. We have so many papers that was already published with positive results for the urban lasers right now, mainly in enamel, but we are working on dentin and right now with the diode lasers as well. So lasers, I should tell you that it's innovative, conservative, reproducible, and effective alternative, not even for dentin hypersensitivity or the prevention of non-carrier cervical lesions, but for all areas of dentistry. And what about if my patient has restoration? And I think we should substitute or not. This restoration is a good one. And we have sometimes just a micro linkage around the restoration. So I can present you the Permaseal. It's a composite sealer, light cure. It's a resin without an unfilled resin with low viscosity that will seal all the irregularities of the restoration. So these are the steps by Ultradent that we have to polish, we have to etch, and we have all this in a very simple kit that we have to make all this procedure that we have to apply to air thin and light cure, and it's ready. So we can prolong, we can increase the time of the restorations in the mouth of a patient. And talking about prevention, we know that if we remove any restoration that should be substituted, what is going to happen? We are going to remove more than tissue, more than necessary sometimes. It's very difficult to remove restoration um, without having some modifications in that substrate, in enamel and dentin. So we're going to remove more. So with Permaseal, it's a very preventive procedure and a very preventive technique. Okay, I will give you some take-home lesson, because nowadays the goal is to prevent. I'll show you the prevention, the prevention, the carious lesions, that we have been trained a lot to do that. We show the patient how to brush their teeth. We show the patient that sugary diet is not going to be healthy for him, not even for his health, general health, but for oral health. We can manage the disease, the carious disease. But right now, the goal is to prevent also the carious and the non-carious lesions. The process using patient-centered, risk-based interventions supported by the best available evidence we have. And we have right now the evidence. We have been talking a lot about science, and science in dentistry is very, very strong, taking into account the dentist's clinical expertise and the patient's treatment needs and preferences. We have to talk to the patients. We have to make the profile of the patient, the risk assessment, in order to maintain or reestablish health and preserve tooth structure. We should make this preservation of tooth structure. Right now, I should tell you that it's a challenging approach, because we are dealing right now with a dentistry that is more multidisciplinary. Sometimes we will talk about the patient, and patient would like to sometimes talk more up with us, and we should send to a doctor or send to any other professional from the health area. So diagnosis is the key, is the basic thing we should know. And prevention comes with the diagnosis. Prevention comes with all the patients, even with the patients that are going to do a big procedure or even a surgery or a restoration. We can talk when we should talk about prevention. There are some interactions between chemical, behavioral, and biological factors. And we are the ones, we are the dentists that will make this challenging approach. To end, I have to talk about my group. Is the GPEC HD that comes from dentin hypersensitivity. We do not work just with dentin hypersensitivity, but with lasers, with ceramics, with composites. But they are 12, 13 young researchers. I'm very proud to talk about them, because they are doing research. They are willing to make our offices, dental offices, better with protocols. And the main objective of the group is to support the clinic with evidence-based protocols. So we are doing a lot of research. They are young. They have motivation to do the research we are doing now. And from right now, we can have this protocol for dental hypersensitivity that is working a lot, doing lasers combined with the potassium nitrate and then with the fluoride varnish and the high power lasers. Oh, I don't have high power lasers. I don't have the photobiomodulation equipment. No problem at all. But if you combine the narrow and the obliteration strategies, you're going to have success. If we're talking with the patient and making a screening of the patients, we are talking a lot with the group this last month about talking about and screening the patient and make all the risk for carious lesions and non-carious lesions, and to know what the patient needs, what he needs, what she needs. He's going to talk to us. and we are the first ones to know their desire. So I would like to thank once again Ultradent for this nice opportunity. It's so many things I would like to say. If you have any doubts, I will be ready to answer them. But once again, thank you, Ultradent, for this nice opportunity to talk to a lot of dentists all over the world. And I have all this contact here in my Instagram, in my Telegram group. We have so many information. It's in Portuguese, but sometimes we can make any discussions in English with some papers or interesting clinical cases also. Thank you, Fabio, for giving me this opportunity, and congratulations on this project, which is amazing. And I saw that in the next month we will have some more activities, and this is quite a nice uh, uh, project. Thank you so much.
Thank you, Dr. Aranya, Ana Cecilia. Thank you, everyone. Wow, I told you, I promised. And of course, I love to put the pressure on you, Anna, and you always deliver. I've learned quite a bit here. I love the techniques that you shared in the process that got you to the current technique. So learning, and again, you had a protocol, and then you started to learn more about the obliteration techniques and incorporating them. And of course, all of this with the science, with the research to back it up. So thank you for sharing, of course, not only your clinical experience, but also the research that you and your team and your colleagues have done to contribute to all our colleagues. We do have some questions here. And so just a reminder, thank you everyone for participating. Please do send your questions in the Q&A session, and we will have a Q&A moment here with Dr. Ana Cecilia. And just before I let you go as well, don't forget to join our onward and upward page. The link is in the chat there, and then you can register for the upcoming presentations. Dr. Ana Cecilia mentioned Dr. Lantran is our next presenter, and she will address specifically photobiomodulation in laser dentistry more in detail. So, Anna, ready for some questions?
Yes, I'm ready.
All right. The first one we got here is from Sheikh Sharia Quader. His question was, does diabetes have any role in non-caries cervical lesions in cause sensitivity?
Diabetes.
Yes.
Okay. No, thank you so much for the question. Yes, diabetes, any systemic thing we have in the patient will make it's a role for non-caries cervical lesions. For diabetic patients, we have to know the diet he's taking and also the medicaments and salivary flow. So salivary flow is going to be an issue, a very important topic for the patient, because we know that saliva has a very important role for the progression of non-caries cervical lesions. We have to check the patient about his salivary flow.
Excellent. Thank you. The next one from Dr. Lee Nick Hui. Dr. Anna, do you manage the occlusal imbalance with unequal loading resulting in cervical erosion from abfraction before restoring the cervical lesions? If so, how do you manage the occlusal imbalance?
Oh, good question. Very nice question. Yes, one thing before doing any treatment, if you're going to desensitize or even making the restoration of the cervical lesions, you have to know the occlusal balance and imbalance. You talk about imbalance, but also the occlusal balance. So sometimes we have to restore the guides and make sure that if you're doing a restoration, it's very normal for you to come with the patient, and 1 year or 2 years after that, you're going to check that the restoration was not a successful strategy. But sometimes not the restoration, the process, but the occlusal balance or imbalance. So it's worth to make the balance of the occlusal, the patient, the balance, occlusal imbalance of the patient before doing the restoration. Because if you're not doing this in less than 2 years, you're going to see that the progression of the disease and the diffraction is going to be longer, the lesion will be longer, and the restoration is not going to be a successful strategy.
Excellent, thank you. Next one we have from Michelle Carthy. Morning, your strategies for dentin hypersensitivity intervention. Consideration for aged care, especially given it's a mobile situation that you have to go to their residence and you have reduced treatment options. How do you address those patients?
Okay, for aged care, especially, yes, given this specific situation, that we have to go to the place to make any treatment, I would say that we have so many products that you can have with you and have and going to a place. For example, the potassium nitrate, the ultra easy. It's very, very easy to apply and to clean after that. So it's easy to apply. And after that, the fluoride varnish is very easy. We do not have to lacquer, so it's very simple to use. Just one thing it's not going to be successfully made is the high power laser sometimes. But even the photobiomodulation procedure or the potassium nitrate, the neuro strategy, it's easy to you to carry with you. And after that, the fluoride varnish, it's very easy procedure. It's very fast. So I do not think it's going to be a problem if you have to go with the materials to a place to treat this kind of patient.
Great, thank you. Now, just following up on that, we did have a comment in the chat just asking you to please repeat if you don't have a laser, then what do you do?
Okay, if you do not have a laser, even the low power laser or the high power laser, I used to use just the potassium nitrate in 3 sessions consecutively. So we are going to use the potassium nitrate 3%, the ultra easy, for 5 minutes. So we'll put the product in the cervical region, the cervical lesion, and stay there. Just make a little bit of scrub in the surface, just to protect all the surface, and leave them for 5 minutes, and then remove with a cotton hole. And after that, I will do this more 2 times. With the lasers, we can see that we have more longevity of the treatment. It will last longer, but it's okay if you do not have a laser. If you do not have a high power laser to do this melting process, you can use a fluoride varnish. It's okay also.
And this is actually from me here. So we do have many countries that actually have Ultra Ease, the 3% potassium nitrate gel available and for take-home use, right? So even some countries, they sell it in pharmacies, or the dentist can actually give the patient a few syringes or the tray for them to wear at home. Would you recommend that for them to apply this at home?
Yes, it's for us here in Brazil. It's a nice thing we have since the beginning of this year, the tray with the potassium nitrate gel, which is a very nice possibility when you have a lot of teeth to desensitize, a lot of teeth to desensitize. If you're not going to have 1, 2, or 3, it's a nice tray to use. I used to recommend not only for the bleaching procedure, if the patient has any desensitizing problem, any desensitizing needs, but the tray is a very nice option if you have a lot of teeth to desensitize. Mm-hmm.
Thank you.
Because it's the same gel, the same product, but it comes in a tray.
In a ready-to-use tray, right? So if you're not familiar, like that Opal Essence Go product, it comes preloaded. Well, I have a few more questions here lined up, but I'll take the opportunity, since we went in that direction, to ask you a note I made here. If you do have sensitivity related to tooth whitening, do you treat it, do you address it the same way with the same technique with obliteration plus neuro, or do you treat it differently?
Before doing the bleaching procedure, I used to treat the dental hypersensitivity he has before doing the dental the bleaching, because otherwise the patient will not. It's going to be very hard for him to do the procedure. So even if it's in office or at home procedures, bleaching procedures. So I used to cover this dentin exposure with this procedure, with this combination of treatments, neuro and obliteration procedure.
Thank you. Next question from Dr. Elias Omar. Is there an option where these materials can be added, polishing paste during prophylaxis? Thanks.
Yeah, you can do the prophylaxis, the polishing paste. Ultradent has one that's very good. And one thing that's very important is to use this polishing paste without any abrasive thing. So Ultradent has one that is very nice one. So without any abrasiveness, more abrasiveness.
Okay. Dr. Kevin Ang, Professor Aranya, any studies linking non-caries cervical lesions, dentin hypersensitivity with sleep disorder breathing that you've come across? That is sleep apnea and snoring.
Yes, we have with sleep disorders, with apnea, so not with snoring, but we have now we are making this association between sleep disorders with non-caries cervical lesions. Yes, we have. And it's close together. So we have an increase in non-caries cervical lesions in patients with sleep disorders.
Okay. Dr. Nahid Perveen, is there any direct connection of chemotherapy and hypersensitivity in how to manage these types of patients?
Yeah, the patient, the oncologic patient, there is undergoing a chemotherapy. Sometimes it's not a problem. The problem is with the radiotherapy, with head and neck radiotherapy. Sometimes that we are going not to have a problem with dentin hypersensitivity, but with the carious lesions, but not with all the patients with chemotherapy. What we should know is that this patient sometimes it's under a very big problem. So sometimes the oral health is not going to be the most important thing right now, but we should talk to him and said that the oral health is very, very important at that time of the treatment. Okay.
I was on mute here, just trying to juggle all the little windows on Zoom. Sorry about that. Next question, Dr. Three Dan. Can you tell more about the role and mechanism of low power laser in your protocol?
Yes, Dr. Len Tran is going to be more detailed about that in 3 weeks, but I can explain that the low power lasers, the mechanism, it's going to be inside our cells. It's going to be absorbed by the mitochondria of our cell. And after being absorbed, we're going to observe analgesia, anti-inflammatory effects, and biomodulation of the tissue. And sometimes we have some papers talking about tertiary dentin that is produced after low power laser also. So we have a desensitization inside of our tooth. So we have so many mechanisms of low power laser. It's not so easy and so fast to explain, but the main thing that will occur is it's going to be inside our cell. So in the morphology of the dentin or enamel, it's not going to happen anything. It's not visible. It's not easy to see that, but it's going to act inside the cell.
All right, thank you. We have a follow-up question from Dr. Lee. further to my question on occlusal imbalance that you've answered, how do you correct the occlusal imbalance?
How do I correct? It depends on the patient, but I have to make all the movements and the lateral protrusion and check the canine guide. And sometimes we have to add composites or even to remove some imbalance that we have. So we have the occlusal papers and make all the movements of the patient.
Right, thank you. Dr. Jeffrey Kestenberg, are there any contraindications to using potassium nitrate or any of the products you mentioned?
No, good. There are no contraindications to use potassium nitrate. It's a very safe gel. It's a safe formulation with the 3% from Ultra Easy, even in the tray, in the ready-to-use tray, or even in the syringe. So it's a very nice product. I have been researching and using in the clinic without any contraindications. Okay.
Thank you. I have, for the moment here, one last question on the Q&A. Dr. Rafiqul Islam asking about management protocol for dentine hypersensitivity due to bruxism.
Yes, it's a very nice question because we have to treat the disease of the patient. For example, we have to treat bruxism before managing and doing a protocol for dental hypersensitivity. Otherwise, if we not treat the bruxism of the patient, we are going to treat one day the dental hypersensitivity, and 1 week after he's going to come back, the patient will come back and say, no, the treatment was not good. I'm still in pain. So we have, first of all, to treat the bruxism, even if you have to make any other treatment. And after that, we are going to treat dental hypersensitivity. So that's the reason why I told you that we have to screen the patient before doing the treatment. And after that, we are going to use all the products and all the associative protocol. Otherwise, if we not treat the patient, the pain maybe will go away, but for shorter period. Then after all, we have to repeat the procedure. It's not good to do that. So we should treat the patient and then manage the pain. Okay.
Okay, thank you. Winnie Olivan Villegas, for patients with pacemaker or any implant on the head, will it be safe to use the laser?
Yes, it's safe to use the laser, even the low power laser photobiomodulation or the high power laser, because it's a very local treatment. So we are going to use it specifically in a place. Sure that over the pacemaker or the implant of the head is not a place they're going to put the laser, but in the mouth it's not going to be a problem if the patient, even if the patient use the pacemaker on an implant in the head. So not going directly to the place of the pacemaker of the implant, but if you're working in the mouth, there is no problem, no contraindications of the use of the lasers.
Great. Let's go. I'm going to scrape the chats here for a couple less questions. And first from Dr. Mohammed Wazed Ali, is there any impact on dentin's hypersensitivity for orthodontic treatment?
Yes, you should screen the patient before doing the orthodontic treatment because we have the movement of the teeth. So it's going to be a risk factor for the development of non-carious cervical lesions and as a consequence for dental hypersensitivity. So the orthodontic treatment right now is a group, the patients are under the group risk. So we should know that sometimes as a consequence of the orthodontic treatment to have the non-carious cervical lesions, but we have to be more attentive to this patient. So we have to make all that prevention measures, talking about waiting to brush their teeth or even to to decrease the acidic from the diet. So we can make all these preventive measures with the orthodontic patient.
Let's go to our very last one from Rowena Karazik-Dalde. Can you use that post-clinical sensitivity protocol after tooth preparation?
Yes. If the tooth is vital and the patient is under pain, you can use the neuro strategies, the potassium nitrate, and also the photobiomodulation to prevent pain after restoration, even if it's direct or indirect restoration. But you can use lasers are a very nice tool for do this, and also the potassium nitrate, because they're not going to make any morphological changes. So if you're going to use an adhesive or anything, it's not going to make any interference. It's not going to interfere. So it's a very nice strategy for vital tooth.
I keep doing this, muting myself and then having windows to move around. Let's do one last question here. This very last minute. Solman Mitra asked, does the mentioned unfilled resin restoration like Permaseal gives better results in dentine hypersensitivity management?
This question it makes me talk about our new research project that we are using Permaseal to dental hypersensitivity, and we have so many good results. I know there is a project, it's an unfilled resin for the restorations, but we are using for sealing non-carrier cervical lesions, and good results.
Okay, can't wait to see it. Yeah.
We're publishing results with Permaseal in dental hypersensitivity, but I would recommend the use.
Thank you. We're going to end the questions now. And once again, I would like to thank you all for participating, for sending your questions. And above all, I would like to thank you, Anna. Wonderful presentation and so spot on. What an important topic. Last time we had you last year, we talked more in depth on laser dentistry. And of course, with your background, with your expertise on the subject, even today, people kept dragging you back to laser here because it was just a tiny portion of it. But we got to take advantage that you have it there. But thank you so much for preparing this presentation for us, for sharing this presentation, for your kind attention, also answering all our questions here, and for letting us have your email address and contact information if we want to reach you with any further questions. So thank you. And to everyone that participated, thank you once again. We hope to see you again on the 1st of September